Welcome to the Infection Prevention and Control presentation on transmission-based precautions. My name is Stefan and I'm a member of the Infection Prevention and Control team. This session is the second of a two-part series. The session aims to refresh your knowledge of transmission-based precautions and is intended to complement your existing training. In this session we will look at some of the elements of transmission-based precautions in more detail. These include personal protective equipment, including respiratory protective equipment, safe management of waste, safe management of linen, safe management of care equipment, safe management of the environment. We will also look at where you can find additional information and resources based on transmission-based precautions. Let's start by looking at personal protective equipment, or PPE. When a resident is being nursed in isolation due to a suspected or confirmed infection, a supply of PPE should be available at the entrance to the isolation room. It is important you follow the correct steps for putting on or donning and for removing or doffing PPE. Appendix 6 of the National Infection Prevention and Control Manual provides a helpful poster advising the correct order for donning and doffing. Hand hygiene should be carried out prior to putting on and immediately after removing PPE. PPE should be removed immediately before leaving the isolation area and disposed of as healthcare waste or by following local regulations for the handling of waste considered infectious. Let's take some time now to look at each item of PPE individually, starting with gloves. Examples of when gloves should be worn include when it is anticipated there will be exposure to blood, body fluids, non-intact skin, hazardous drugs, chemicals or cleaning agents. Gloves must never be worn inappropriately, for example when moving between residents, moving around a care area or working at IT workstations. Gloves should be changed if a perforation or puncture is suspected or found. Gloves should be appropriate for use, fit for purpose and well-fitting. Gloves are not a substitute to carrying out hand hygiene, and gloves must never be decontaminated with alcohol-based hand rub. Let's now look at aprons and gowns. An apron should be worn when caring for a resident with a suspected or known infection and when in contact with the resident's environment. Disposable plastic aprons should be used for protection against contamination with blood and/or body fluids. A fluid-repellent gown should be used if excessive splashing or spraying is anticipated. A full-body fluid-repellent gown should be worn when conducting aerosol-generating procedures, also known as AGPs, on a resident known or suspected to be infected with a respiratory infectious agent. AGPs will be discussed in more detail a little bit further on. Let's now look at eye and face protection. A face visor or goggle should be used in combination with a fluid-resistant surgical mask, also known as an FRSM, when caring for residents with an infection transmitted by droplets, for example, influenza. A face visor or goggle should be used in combination with a fluid-resistant filtering face piece level 3 or FFP3 mask when caring for a resident infected with an airborne transmitted infection, for example, pulmonary tuberculosis. Eye face protection should be worn by all of those in the room if potentially infectious aerosol-generating procedures are being carried out. Next, we will look at fluid-resistant surgical masks, also referred to as FRSM. An FRSM should be worn when caring for a resident with a suspected, confirmed infectious agent spread by the droplet route. In certain instances, it may be recommended FRSMs are worn, where tolerated, by residents with suspected confirmed infectious agents spread by the droplet or airborne routes. Your local health protection team will advise if it is recommended a resident or residents wear masks. Now we will look at respiratory protective equipment, or RPE. The use of FFP3 masks is governed by health and safety regulations. FFP3 masks must be fit tested to the user to ensure the required protection is provided. FFP3 masks should not be worn by staff who are not trained in their use or who have not been fit tested. The Health and Safety Executive, or HSE, provides information regarding fitting and fit checking of RPE. We will pause here for a reminder that RPE, for example FFP3 masks and facial protection, should be considered when a resident is admitted or develops a known suspected infection spread wholly by the airborne route, or when carrying out an aerosol generating procedure on a resident with a known or suspected infection spread by the airborne or droplet route. An aerosol generating procedure, or AGP, is a medical procedure that can result in the release of airborne particles from the respiratory tract. This is associated with an increased risk of transmission when caring for someone who is suspected or known to have an infection transmitted by the airborne or droplet route. An example of an AGP that may be undertaken in your care home is continuous positive airway pressure ventilation, also known as CPAP. More information and a full list of medical procedures reported to be aerosol generating and requiring additional precautions can be found in Appendix 17 of the National Infection Prevention and Control Manual. Now we will look at how to manage the waste generated when a resident with a suspected or confirmed infection is nursed in isolation. All waste from the isolation room of a resident with a suspected or confirmed infection should be considered infectious and disposed of as healthcare waste. Care home waste disposal may vary between homes, and it is important you adhere to guidance from local contractors and follow local regulations for the handling of waste considered infectious. Waste should be disposed of inside the isolation room. Once waste bags are 3/4 full, the bags should be secured before taken to the waste storage area. Use a swan neck technique for closure of the bag before labelling the bag with date and location as per local policy for the care home. A swan neck is a way of closing the waste bag by tying in a loop and securing with a zip tie or tape to make a handle. We will now look at linen. All linen used by a resident with a suspected or known infection should be considered infectious. Prior to removing infectious linen from the isolation room, place the linen directly into a water-soluble laundry bag and secure by tying the top of the bag before putting into a clear plastic bag and placing in a laundry receptacle, trolley or buggy. An information poster is available to support staff involved in the handling of infectious linen. Have you seen the poster on display in your care home? Cleaning and decontamination of care equipment is essential to reduce the spread of infection. When a resident with a confirmed or suspected infection is being cared for in isolation, use single-use equipment or dedicate reusable care equipment for the resident during the period they are in isolation. Examples of reusable care equipment are hoists and commodes. It is important reusable equipment is cleaned and decontaminated after each use and before the equipment is removed from the resident's room once isolation has ended. Appendix 7 of the National Infection Prevention and Control Manual provides a helpful flowchart to guide staff on the decontamination of reusable, non-invasive care equipment. You may wish to display a copy of the flowchart in an area within the home where it will be visible to staff. When cleaning the room of a resident being cared for in isolation, it is recommended staff clean and decontaminate the isolation room at least daily or more frequently if advised to do so. Clean frequently touched surfaces such as door handles, bed frames and bedside cabinets at least twice daily. It is important you use the correct cleaning products when cleaning the room of a resident in isolation. The National Infection Prevention and Control Manual recommends a combined detergent disinfectant solution at a dilution of 1,000 parts per million available chlorine, or a general purpose neutral detergent in a solution of warm water, followed by a disinfection solution of 1,000 parts per million. Remember, the refillings of spray containers containing cleaning products is not recommended due to the risk of contamination. A terminal clean of the resident's room is carried out when a resident is no longer considered infectious. A terminal clean is carried out by removing all waste and other disposable items from the room before disposing of as healthcare waste, or by following local regulations for the handling of waste considered infectious. Removing bedding and curtains. These should be bagged as infectious by placing a water-soluble bag, then a secondary plastic bag before removal from the room for washing as infectious linen. All reusable care equipment in the room should be cleaned and decontaminated. If items of equipment are to be removed from the room, it is important they are cleaned and decontaminated prior to removal. Once items have been removed from an isolation room, carry out a terminal clean using either a combined detergent disinfectant solution at a dilution of 1,000 parts per million, or a general purpose neutral detergent in a solution of warm water, followed by a disinfection solution of 1,000 parts per million. The room should be cleaned from the highest to the lowest point and from the least to the most contaminated point. Always remember to follow the manufacturer's guidance and recommended product contact time for the cleaning disinfection solution used to carry out the terminal clean. Further information of safe management of the care environment is available via the cleaning specification for care homes. The specification includes sample cleaning schedules and standard operating procedures which detail the equipment required, as well as each step in the process when carrying out cleaning within the home. As we approach the end of the session, we will discuss infection prevention and control during care of the deceased. When a resident dies in the care home, standard infection control precautions and transmission-based precautions should still be applied. This is due to the ongoing risk of transmission via contact. Guidance on precautions required and what is permitted, for example, viewing, washing and dressing, can be found in Appendix 12 of the National Infection Prevention and Control Manual. Relatives should be informed of any precautions it is recommended they take when viewing or having physical contact with their loved one. We have now reached the end of the second session of our two-part series on transmission-based precautions, or TBPs. Additional information on TBPs can be found in Chapter 2 of the Care Home Infection Prevention and Control Manual. The Care Home Specific Manual is a practice guide for use in care homes, which, when used, can help reduce the risk of infection and ensure the safety of those being cared for, as well as staff and visitors. Please visit the Resources section of the manual, where you will find materials developed to help promote infection prevention and control in your area, including posters detailing the TBPs required for infections spread by either the contact, droplet, or airborne route. Please also visit the National Infection Prevention and Control Manual, where you will find the appendices referred to earlier in this session. For additional resources on topics such as standard infection control precautions, and to view our hand hygiene video clips, please visit the Care Home Collaborative webpage. Thank you for your time. We hope you have enjoyed the session.